This is the most embarrassing video that I've ever done. So if you get offended very easily, please keep scrolling, but I promise you this will stick in your brain. Antidotes to potassium. Okay, so when we have too high of potassium, we are going to have major heart problems. Remember, your keyword with potassium is heart. Okay, so I'm going to go over the 6 antidotes to potassium. This is highly testable and on NCLEX. Okay, so potassium can be one of 2 places. It can either be in the blood or it can be in the cells. It prefers to be in the cells because it's an intracellular electrolyte, okay? But when you have high potassium or hyperkalemia, you have too much in the blood and we need to drive it into the cells, okay? So how are we going to drive it into the cells? With a dick. And that's how you, I'm sorry, my mom's not watching this. This is our acronym for how to get rid of hyperkalemia and drive the potassium from the blood into the cells with a dick. So we are going to use either albuterol, okay, that is one of the antidotes, either dialysis. Now, dialysis won't drive it into the cells. It'll actually clean it out of the blood. We can use diuretics, which will help you to pee it out as long as the kidneys are healthy. We can use insulin. Insulin will do some driving, okay? Calcium gluconate will help as well. Won't drive it into the cells necessarily, but it will help with hyperkalemia. Kxalate. Now, this is the actual antidote to hyperkalemia, okay? On an exam, though, or on NCLEX, you may see it called sodium polystyrene sulfonate, okay? Very big, long, fancy word, but you need to know it, okay? And then the last one is sodium bicarb, okay? Now, I go into great detail in how these work in my video on YouTube, so be sure to check that out, okay? But to recap, potassium, keyword is heart. We're worried about arrhythmias. There's too much potassium in the blood. We need to drive it into the cells with what? A dick, okay? Albuterol, dialysis, diuretics, insulin, calcium gluconate, Kxalate, or sodium bicarb. Those are our options to decrease patients' potassium so that they do not have arrhythmias. Sorry, Mom.